Hi, my name's Scott Freed. I'm an orthopedic surgeon, and I'm here today to talk to you about the DITH neck-free shoulder. This is a large pillow, which you will use intermittently. And then the device itself looks nice and small, and it is. And that's one of the beauties of it, because it fits just as a fanny pack would, and you can immobilize your arm and shoulder in this manner. Here you see all the component pieces to the neck-free shoulder system. The main bag, the main shoulder mobilization bag, is right here. When you receive this, after it comes apart, you are going to have it set up for right-handed use. You have this upper arm strap where the upper arm will go in, the forearm strap. This piece will be on the arm board, and it can be moved and adjusted, basically, in any way that is comfortable. For the arm board is to support the arm and forearm like this. And then the wrist strap piece, which will come over like this, which we will show in greater detail. Now, when it comes to you initially, it is going to have the big pillow and the pack portion will be together. The T-piece will be on here, and the arm board will be sitting like this. So, to begin to utilize it, you will likely be utilizing this just as a smaller pack to immobilize the arm without the large abduction pillow piece. So you will just remove the arm board, lift up and remove the T-piece, and you will utilize these for the full abduction. You will then take this portion off, and you have the pack portion. Again, we are set up for right-handed use. You will simply unclip the belt and place this around your waist and adjust it to fit you, clipping the belt. You now have the device on. The upper arm loop simply places this, and you can see it's very easy to do to yourself. If you want the arm board on, you place the arm board and you put it in a comfortable position for you. Likely will be about here. The forearm loop, it is important to come from the outside in, bringing your arm this way, across the top of the bag, from out away onto you. And then you have your hand and wrist set, and you just place the wrist strap over your wrist, which will hold you securely. And this is all you need to do to get yourself in. And then snug up nice and tight, and you are very secure in your immobilization. If you could help me with the upper arm strap here, because you may need to ask someone, so you just call a good friend and say, okay, will you help me with the upper arm strap? And then you just bring that across securely, as in such. And it loops right onto the belt and the Velcro portion of the belt. And that is it, and that is the immobilization. That is as easy as it is to apply. When you want to come out of it, or you want to utilize a larger pillow, if you want intermittent abduction, you will use the pillow which is inside here. I have it here. And this is the small pillow. So if your doctor or therapist says limited abduction, you will do this. And then for 30 minutes a day, you will put that pillow in, restrap yourself in with the belt, and you will have partial abduction. If the doctor recommends full 90 degrees of abduction, you will utilize the full immobilization pillow, the full abduction pillow, and you will put it up here. If you require rigid airplane abduction, in other words, rigid abduction or positioning like this for a long period of time, you would have added the Kate come over, and I'm going to show you a little bit about how easily this is worn. I put that on. That arm is just not going anywhere. Kate is securely moved, immobilized. This shoulder and arm and forearm are supported. So if you have a shoulder injury, you have a humerus fracture, you have an elbow fracture, even the wrist and hand involved, this will support that very nicely and keep us just like that. And what we want to do is just be sure that the patient is comfortable. It is truly a unique, one-of-a-kind device, allowing early abduction of the shoulder, avoiding frozen shoulder, cosmetically pleasing, comfortable for the patient, and clinically effective. Thank you so much.